Welcome to Courier. Today we will talk about environmental factors that affect our health. The truth is, it's challenging to pin down exactly what factors cause an environmental health problem. Health problems related to the environment are complex and develop for a variety of reasons. What we do know is that an environmental health problem is likely linked to physical, biological, and even economic factors. Some potential sources of environmental health problems include air pollution, from car exhaust to wildfire and e-cigarette smoke to ozone. Pollution is a mix of natural and man-made substances found both indoors and outdoors. Lead, old paint, contaminated soil and water, pottery and even house dust are a few ways people are exposed to this metal. Perfluorinated chemicals, these compounds help reduce friction and also are used to make products resistant to stains, water and grease. Smoke. A single cigarette is chock full of hundreds of chemicals including arsenic, formaldehyde and lead. Pesticide. These chemicals kill, repel or control pests from weeds and fungus to insects. Climate change and health. Key facts 1. Climate change affects the social and environmental determinants of health: clean air, safe drinking water, sufficient food. 2. Reducing emissions of greenhouse gases through better transport, food and energy use choices can result in improved health, particularly through reduced air pollution. Climate sensitive health risks. Climate change is already impacting health in a myriad of ways, including by leading to death and illness from increasingly frequent extreme weather events, such as heatwaves, storms and floods, the disruption of food systems, and food, water and vector-borne diseases, and mental health issues. Thanks for watching. Make sure hit the like button, and don't forget to subscribe and share with your friends and family.